Imagine an infection you catch during sex. No pain, no fever, no obvious symptoms. Your immune system might clear it and you'd never know. But sometimes the infection remains, hiding inside your cells for years. And certain viruses can slowly interfere with the very systems that control cell division and prevent cancer. This does not mean every sexually transmitted infection causes cancer. Most don't. But a few, especially HPV and hepatitis B, have well-established connections, and one of them causes cancers in both women and men. Today, we're going inside ourselves to see how an STI can become a cancer risk, and more importantly, how many of these cancers are preventable. You've heard both STD and STI. STI, or sexually transmitted infection, is often preferred by healthcare professionals because a person can carry and transmit an infection without any symptoms or obvious disease. Common STIs include chlamydia, gonorrhea, HPV, HIV, and hepatitis B. But here's the critical distinction. Most STIs do not directly cause cancer. The strongest cancer connection belongs to a few persistent viral infections. Let's meet the biggest player, human papillomavirus, or HPV. It's the most common STI. Most sexually active people will get it. Now, there are many types of HPV, and most infections disappear on their own, cleared by a healthy immune system. But some high-risk types can persist for years. This is where the story changes. When a high-risk HPV infection lingers, it can produce proteins that disrupt our body's natural safeguards. Think of these safeguards as cellular brakes. They stop damaged cells from dividing. HPV can cut those brake lines. Abnormal cells that should have been destroyed are allowed to survive and multiply. Over many years, this can lead from normal tissue to precancer and eventually to invasive cancer. HPV is linked to 6 major cancers: cervical, anal, penile, vaginal, vulvar, and cancers of the oropharynx, that's the back of the throat. This is not just a women's issue, it affects everyone. The link is especially dramatic with cervical cancer. More than 9 out of 10 cases are caused by HPV. But here's the powerful part. Cervical cancer is also one of the most preventable cancers. With the HPV vaccine and routine screening, we can interrupt the process long before cancer develops. We can find the dangerous changes early, remove them, and the cancer may never get a chance to form. Now let's move to the liver. Hepatitis B virus, or HBV, is transmitted through blood and body fluids, including during sex. While most adults recover from an acute infection, the danger comes when it becomes chronic. The virus can then remain in the liver for decades, creating repeated inflammation and injury. Over time, that constant damage can lead to severe scarring, called cirrhosis, and for some, that can lead to primary liver cancer. The CDC estimates 15 to 25% of people with chronic hepatitis B will develop serious chronic liver disease, which includes that risk of liver cancer. What about HIV? Its role is different. HIV doesn't directly turn a healthy cell into a cancer cell like HPV can. Instead, untreated HIV attacks the immune system. Your immune system doesn't just fight infections, it also patrols your body, destroying abnormal cells and cancer-associated viruses. When HIV weakens those defenses, the risk of certain cancers rises, including Kaposi sarcoma, some lymphomas, and the HPV-associated cancers we just discussed. Effective HIV treatment restores immune function, which is why testing and treatment are so critical. This next part is important because of online misinformation. Let's be clear. Genital herpes is not considered a direct cause of cancer. Neither are gonorrhea or chlamydia. These infections can cause other serious health issues and absolutely require treatment. But we should not label every STI a cancer-causing infection. The scientific evidence simply doesn't support that. So, how do we fight back? The great news is these infections and the cancers they cause are highly preventable. Here's your action plan. 1. Get vaccinated against HPV. It's a cancer-preventing vaccine. It's recommended for preteens, but catch-up vaccination is available through age 26 and is worth discussing with a doctor even after that.
2, get vaccinated against hepatitis B. This is another vaccine that can prevent liver cancer by preventing the infection that causes it. 3, use condoms. They substantially reduce transmission of many STIs.
Just know they don't provide complete protection from viruses like HPV that can be on skin the condom doesn't cover. 4, get tested. Many STIs have no symptoms. Testing is the only way to know your status and get treatment if you need it. 5, follow cervical cancer screening guidelines. For women, this detects HPV-related changes years before they can become cancer. 6, have honest conversations with partners about sexual health and testing. This helps everyone make safer decisions. 7, for those at increased risk of HIV, consider prevention options like PrEP. And 8, never ignore abnormal symptoms. See a doctor for anything unusual. Early evaluation is always the best path. So, what's the real relationship between STIs and cancer? Most do not cause cancer, but a few specific viruses are major players. Persistent high-risk HPV can cause cancers of the cervix, anus, penis, vagina, vulva, and throat. Chronic hepatitis B can damage the liver and increase liver cancer risk. But here is the most important message. These cancer risks begin with infections we already know how to prevent. We have the tools. Vaccinate, screen, test, practice safer sex, treat infections. Because preventing cancer doesn't always start with finding a tumor. Sometimes it begins decades earlier by preventing the infection that could have started it all. Thanks for listening. Subscribe to Cell-Wise Health, where science meets everyday health. Podcast ends.